Aging is natural, but staying safe in extreme heat requires awareness. I'm Dr. Jack Stone. Many people think of hot weather as merely uncomfortable, but after age 60, especially if you take regular medication, hot weather can put more strain on your body than you might think. According to the CDC, adults age 65 and older are more susceptible to heat-related health issues, and certain medications can increase the risk of dehydration, electrolyte imbalance, or overheating. And here's the part most people don't realize. The problem isn't just the heat. The problem can sometimes be daily medications combined with the heat, a blood pressure medication, a diuretic, even other common medications taken without realizing it. Today we'll discuss which medications require extra caution in hot weather after age 60, why the risk may increase, and what simple protective steps doctors generally recommend. The CDC specifically emphasizes the importance of creating a personalized plan for certain medications on hot days, monitoring fluid intake and symptoms, and not adjusting medications on your own. Stay tuned, because sometimes it's not just the weather that's challenging you during the summer months. Part 1. Why does hot weather affect people over 60 differently? Many people think of hot weather as just being uncomfortable. You sweat a bit, get a little tired, then move into the shade and relax. But after age 60, the picture isn't always that simple. The reason is that as you age, the way your body manages heat can change. The CDC states that adults age 65 and older are at higher risk for heat-related health issues. One reason is that the body's ability to cool itself through sweating and blood circulation may become less effective compared to when you were younger. Additionally, the fact that many older adults live with chronic illnesses and take regular medication can also increase the risk. Another important point is the sensation of thirst. As people age, the sensation of thirst can weaken in some individuals. This means that even if the body needs fluids, the person may not realize it until later. This becomes particularly important in hot weather, as the body loses more fluids through sweating. If this loss is not replenished, it can lead to weakness, dizziness, fatigue, and in some cases, more serious issues. Let me give you a small but very common example from real life. On a hot summer day, a person in their 70s might go out in the morning feeling perfectly fine. But by midday, especially if they're out in the sun, haven't drunk enough water, and are taking medications that affect the body's fluid balance, they might suddenly start feeling weak, dizzy, and unsteady. The problem isn't just the heat. Age, fluid balance, and the effects of medication all work together when combined with heat. That's why doctors generally recommend a very simple, yet important approach for people over 60 in hot weather. Don't underestimate the heat. If what I've described sounds familiar to you, leave a comment. What symptom do you experience most in hot weather? Is it fatigue, dizziness, or extreme exhaustion? And if you find this kind of simple yet truly helpful health content useful, don't forget to like the video. This helps similar content reach more people. Because sometimes it's not just the heat itself. It becomes risky because the body can no longer respond to it the way it used to. Part 2. Which medications can increase the risk in hot weather? First, let's make this clear. The purpose of this section is not to scare people away from their medications. Many medications are necessary, beneficial, and even life-saving. The issue is usually not the medication itself, but the body's reaction when it interacts with hot weather. One group of medications that doctors particularly advise people to be more cautious about on hot days is diuretics. These medications help the body eliminate excess fluid and are often used for conditions like high blood pressure or heart failure. However, if fluid loss is already occurring due to sweating and hot weather, these medications can make feelings of thirst and dizziness more pronounced in some people. Another important group includes certain blood pressure medications. These medications help lower blood pressure. This is usually a desired effect, but since hot weather, sweating, and fluid loss can also affect blood pressure, some people may experience more fatigue, dizziness, or lightheadedness upon standing than usual. In addition, certain antihistamines, some sedatives, and certain psychiatric medications can also affect how the body responds in a hot environment. Sometimes they can cause dizziness, sometimes they can make it harder to notice dehydration, and sometimes they can alter the body's response to heat. The important thing here isn't memorizing drug names. What really matters is asking this question. Could the medications I'm taking cause dizziness, dehydration, or extreme fatigue in hot weather? This question is particularly valuable for those over 60. Many people assume that feeling more tired, unsteady, or weak during the summer is simply due to the weather. However, sometimes the effects of medications may also be a factor. And when these two factors combine, the risk can increase slightly. The best course of action here is not to stop taking the medication on your own, but to talk to your doctor or pharmacist. Sometimes, simply monitoring your fluid intake, adjusting your schedule, or being more careful on hot days can make a big difference. In short, hot weather can put extra strain on the body when combined with certain medications, and recognizing this early is one of the smartest ways to prevent serious problems. Part 3. Dehydration and electrolyte loss. The real issue isn't always the heat, but the body's response. Now let's get to the heart of the matter, dehydration and mineral loss. Because in hot weather, the problem is often not just the high temperature. The problem is how the body responds to that heat. When the body heats up, it does two key things to protect itself. It dilates blood vessels and tries to release heat through sweating. This mechanism is very smart, but it comes at a cost. Fluid loss, and along with it, sometimes the loss of minerals like sodium and potassium. A younger body can adapt to these changes more quickly, but after age 60, this balance can become more delicate. Especially if a person isn't drinking enough fluids throughout the day, spends a long time in a hot environment, or is taking medications like diuretics, the body may eventually struggle to tolerate it. This is exactly where people usually miss the first signs. Because thirst doesn't always start with, "I'm really thirsty." Sometimes the first symptoms are much more subtle. Mild headache, fatigue, weakness in the legs, slower thinking, dizziness upon standing, and muscle cramps in some people. Many people attribute these symptoms to hot weather, age, or poor sleep. Yet sometimes the body is actually sending the message, "I'm losing fluids and balance." This pattern is particularly common in people who feel normal in the morning, but noticeably worsen by the afternoon. Because fluid loss usually doesn't happen all at once, it builds up gradually throughout the day before taking effect. One of the simple recommendations doctors often give is this: don't wait until you're very thirsty to drink water. Spread your fluid intake throughout the day. Be sure to hydrate before going outside, while you're out, and after returning home. Another important point is this: if you experience significant fatigue, confusion, palpitations, muscle cramps, or dizziness in hot weather, you shouldn't dismiss it as normal summer fatigue. If any of these symptoms are happening to you or someone close to you, leave a comment. What's the first symptom you notice in hot weather? Because sometimes major issues start with very small warning signs. Part 4. How to protect yourself in hot weather. Simple but effective measures. First and foremost, the most basic rule is don't wait until you're thirsty. Many people only remember to drink water when they're thirsty. But since the sensation of thirst can diminish after age 60, this method isn't always reliable. That's why doctors often recommend spreading out fluid intake throughout the day. Drinking water upon waking up, with meals, and especially before going outside can be a simple yet effective habit. Second, you need to be careful during the hottest hours of the day. Staying outside for long periods, especially between noon and late afternoon, can put a greater strain on the body. If you must go outside, staying in the shade, taking frequent breaks, and moving to cooler environments whenever possible is a good idea. The third important point is how you dress. Lightweight, light-colored, and breathable clothing can help the body manage heat more comfortably. Sometimes even such a small change can make a person feel much better. Fourth, it is very important not to change your medications on your own. Even if you feel weak in the heat, stopping or reducing your medication is not the right approach. The safest step is to ask your doctor or pharmacist this question: can the medications I'm taking cause dizziness, dehydration, or weakness in hot weather? Fifth, you should not ignore the signals your body is sending. If you experience significant dizziness, extreme fatigue, muscle cramps, confusion, a feeling of fainting, or shortness of breath in hot weather, you should not dismiss these as normal summer fatigue. These symptoms may be important signs that require discussion with a doctor. And finally, remember this: the information in this video is for educational purposes only. Especially if you have a heart, kidney, or blood pressure-related condition, the best approach is to work with your doctor to determine the safest plan for you during hot weather. In short, hot weather alone isn't the problem, but when age, medications, and fluid balance come together, the risk can increase. And sometimes the best protection isn't complex solutions, it's small but mindful habits.